Hi and welcome to Hoxton Therapy. This is a narration of one of our articles. London Therapist. London Therapist. We offer a range of individual therapy services included Cognitive-Behavioural Therapy, Dialectical Behaviour Therapy, emotion-focused therapy and mindfulness and acceptance-based treatments. Our individual therapy is focused upon addressing the problem in your life most affecting your quality of life, including problems related to mood, anxiety, substance use, anger and impulsivity, among a range of other concerns. We have London therapists who also have additional expertise dealing with more severe problems such as suicidal ideation, trauma and self-harm. These are one-on-one sessions that occur for 50 minutes per week, with the length of the treatment dependent on your individual needs. Cognitive-Behavioural Therapy, or CBT, is a type of psychological treatment used to help people with a variety of different mental health problems. CBT is based on the idea that psychological difficulties often result from the interplay of thinking patterns, emotions, actions, and situations. Learning CBT from a therapist can help you get a greater insight into the types of thought patterns that generate your depressive, anxious, angry, or many other problematic and distressing emotions and reactions that are having a specifically negative impact on your life. Research has suggested that CBT with a London therapist should be considered the first line of treatment for depressive and anxiety disorders. It is that effective. CBT will target the hopeless and negative thoughts in depression, the helpless and catastrophic thoughts that trigger anxiety, and, overall, the types of thoughts that negatively impact a person's mental health. CBT involves learning to identify problematic patterns of thinking, emotions and actions, and to change behaviours and develop new coping skills. CBT is particularly effective for depression, anxiety disorders, problems with anger, and general stress. There is also evidence that CBT is helpful for people struggling with substance use problems, symptoms of psychosis, chronic pain, and other problems. Dialectical Behaviour Therapy, or DBT, is an evidence-based treatment. Originally, this treatment was designed for individuals who were in frequent crisis, suicidal, and struggled with coping with their day-to-day life. DBT now has been validated for a variety of other disorders such as PTSD, depression, anxiety, addictions, eating disorders, mood disorders, impulse and control disorders, personality disorders, and for those with other self-injury behaviours. The main goal of this treatment is to assist people in improving their quality of life. DBT works best when you participate in both groups and individual skills training. You will learn new skills to help you learn better to identify and cope with your emotions, better tolerate distress, and learn more effective ways of communicating in a skill-based training course. In individual therapy, you will focus on reducing or stopping problematic behaviours that interfere with achieving your goals, addressing queries, and learn how to tailor the DBT skills to your needs. Between session skill coaching is also available with your individual London therapist. Emotion-focused therapy, or EFT, is an empirically supported treatment that addresses challenges that can arise when an individual's reaction to and processing of emotion has become problematic. In turn, challenges to mental health and quality of life. This therapy focuses upon an individual becoming more aware of his or her emotional experiences and better able to process and experience his emotions adaptively, rather than avoiding or otherwise experiencing emotions in a way that leads to maladaptive responses. With an evidence-based area such as grief, depression, and anxiety, this modality facilitates a stronger and healthier connection to the experience of emotions, with individual sessions having a focus upon moving from emotion routinely causing distress to there being an integrated aspects of the person's sense of self and resilience. Whatever London therapist you choose, they'll be there to talk through any of your issues. Hi, we hope you enjoyed that narration of one of our articles on our website, hoxtontherapy.com. As usual, we have our podcast which answers your question, and the name of the podcast is the Ask Hoxton Therapy Show. You can ask us questions on social media and we will answer those questions in upcoming either video content, and of course when our video content's done, our podcast content audio is done as well. So stay safe out there. It's COVID-19 at the moment. Till next time, goodbye. Never act on any advice given in these articles, videos or audios. Always seek professional help before acting on anything you read or watch or listen to on this website, or in our podcast, or on our YouTube channel, or anywhere on our social media.